So welcome, Joyce. Are you able to give us some more specifics on the case that was confirmed in Elgin County recently?
He was a 30-year-old, he was a male in his 30s who works outside of our area and was in contact with individuals there who may have had COVID, and that's where he got it. He was appropriately identified at the London Health Science Centre, and they tested him, and when he was positive, we were informed. We've been in touch with him ever since, and he's been in isolation since that point in time. We've been following up with all of his contacts.
And sorry, was it him that went to the ICU the other night?
He went to the emergency department at Stag and is in hospital right now.
Okay.
He had several other health issues which made him at more risk for getting a worse disease, and that led to his hospitalization.
Can we let people know what some of those risks are?
I can't talk about our case specifically because of privacy issues, but we do know that there are several risk factors. So people who are older, particularly over 70, they're just as you get old, your immune system gets a bit tired, so they're more at risk. And then people who have weaker immune systems for a variety of different causes, such as cancer, diabetes, heart disease, chronic lung disease. Sometimes they're on medications which suppress your immune system. All of those people are at increased risk and need to be especially diligent that they take precautions to stay away from other people and try to protect themselves from getting the virus infection.
And do you think with less cases in our region compared to others, does that mean that the risk for local residents is lower?
I would say that the risk is creeping up for our local residents. We have seen in Toronto that they have evidence of this infection spreading through the community. Locally, we've tested quite a large number of cases, and the most, except for this one case, which wasn't even tested in our area, all our test results are coming back negative. So that means at the moment we don't have any solid evidence of it being extensively in our community. That said, at the moment we are advising anybody who has traveled and who has the symptoms compatible with COVID-19, such as fever, cough, difficulty breathing, to stay home. And we are treating those people as if they had COVID. And we've got a handful of those people here as well. So we think that there is COVID in our environment, so I wouldn't say the risk is low anymore, that it is moderate, but it's definitely not high yet.
And how many cases do you think it would take to trigger a local assessment centre, or in what circumstances?
So assessment centers are there to manage the additional requirement to see patients if our current health system is not able to handle it. So it's sort of like an overflow area. And at present, our health system is getting quite organized, and we definitely can handle the local volume. Our emergency departments are still able to staff without the need for additional help there, so they're able to see the patients. We send them our way. Our primary care doctors are many of them are beginning to practice through using virtual medicine methodologies that the province is providing, so that they can see their patients over the computer like you and I are talking right now. They're also doing assessments over the telephone. And so our local family doctors and community health centers and nurse practitioners are able to keep up with the volume. So we are keeping an eye on this, and when the need arises, to ensure that people can get seen in a timely fashion, and that we need additional resources from what we already have, then we'll consider the assessment centers. We're also doing this in conjunction with the Ministry of Health, who is actually gives the green light for an assessment center to open. So that's the factors that are in play.
Understand. And can you remind people again what the process is if you feel like you need to be assessed?
So we are devising an infographic, which we hope to circulate to our community, which will guide them through how to navigate through the system. First of all, we suggest that if you have symptoms, that you do the self-assessment tool that's provided by the Ministry of Health and you can find online. And then if you go through the self-assessment tool and it seems to indicate that you might have symptoms that are consistent with COVID and you need some further advice from your healthcare provider, that you either call telehealth or that you call your primary care provider to get some further information. And if those two aren't available, you can call public health. And through those channels, the experts will advise you as to whether or not you're safe to stay home and just monitor your symptoms, or whether you are at risk for getting and needing further assessment and actually need to go see a physician, be it via your primary care provider or via, more likely, the hospitals.
Okay, great. And has the public health unit worked with local hospitals to put restrictions in place to reduce the spread of COVID-19?
So the hospitals and the health units do link through infection prevention and control teams that are in place both at the health unit and at the hospital. These teams have regular weekly calls so that we're all on the same page and that we're all using the most up-to-date requirements. As well, the hospitals have long-standing protocols in place for infection prevention and control that they use every day, whether it's COVID or not. So they're very skilled at how to do this, and they're putting all their skills to work at this point in time.
Yeah, another question we had was, with the World Health Organization urging more testing, why aren't these tests being done with everyone who has symptoms?
So in an ideal world, we would like to test as many people as we could. However, this is currently an international infection. And so these testing kits are required all over the planet. So at the moment, they are a little bit in short supply. So we've had to make some careful decisions so that we ensure that we differ from the times when it's nice to know that you have COVID-19 and when you really need to know. So we really need to know for those sicker people who are in hospital, and we really need to know for some of our essential workers, such as our healthcare workers, if they have it, because we don't want them treating patients if they're sick. So at the moment, we've got more limited criteria for swabbing. I also know that there is a very extensive work being done at the provincial and federal levels to ensure that we have a steady flow of supplies to do the testing, and that we ramp up this so that we can extend our testing when it's available. So for now, we are using clinical criteria to advise most people whether or not they have risk of COVID, such as whether they have the cough, the fever, or the shortness of breathing, and we're saving our tests for those situations where it really does make a difference, where we need to know and where it's not nice to know.
There's a lot of information out there. Are you immune to COVID-19 after you have it?
So, okay. So at the moment, the work is being done to determine whether you're immune or not. To figure that out, we need to measure the antibodies that your body creates in your system. And if you have mature antibodies, that usually reflects some degree of immunity. And so at the moment, we do know that from research done in China and other places that people do develop immunity, and it does last for a few months after their infection. We don't really know how long. We do also know that coronavirus that's causing COVID-19 is part of a family of coronaviruses. These other cousins of this new coronavirus do circulate every winter. And we do know that every winter, again, people are at risk for getting infection. So we suspect that you'll have immunity from this for some time, but how long, we will have to wait and see.
Now, with the directive for people to stay at home, except for those who are deemed essential that must go to work, some people are finding that message confusing to say we're a household where their father works from home or has been laid off, and the mother has to go out and do her normal shift at the grocery store, or the father has to go and do his job at the hardware store.
Okay, so in that scenario, we ask the family members to continue carrying on their daily activities and to very carefully monitor themselves for any symptoms. And as soon as they have even the mildest of symptoms, to let their bosses know and then to refrain from work. So we're thinking that the other family members are not infectious and can't spread the disease to other people as long as they don't have symptoms. There has been some talk about whether people can spread it while they're not having symptoms. That's not yet clear. Some research out of China says that the majority of people who we even think are asymptomatic or don't have any symptoms, that if you really ask them carefully, they do at least have some very minimal symptoms. So we're saying if you feel at all unwell in that sort of situation, that you should let your employee, your boss know and stay home, but that you're probably safe to work even if your family member is ill, as long as you carefully monitor yourself, because as long as you don't have symptoms, you're probably you're not able to spread it to another person.
Understand. And with that, some people are worried about going to the grocery store, possibly getting in contact with other people or even the cashier. Do you have any suggestions for going out and having to do these chores?
So this is where it depends on all parties. So most of our retailers have been provided with instructions, either from their head office or they'll be getting it from us before long, about how to make sure that their workplace is safe both for their customers and for their employees. So that's things like trying to make sure that their high-touch surfaces are cleaned frequently, that they screen their personnel as well to be sure that they're not sick when they're coming to work, and that they try and set up their store so people can stay roughly 6 feet or 2 meters apart from one another. So that's what the stores are doing themselves. And you as a customer, don't go to the store if you have any symptoms at all, even the most mildest symptoms of the cold. Do stay home. And then if you do go to the store, be sure to wash your hands carefully before you enter the store. If you happen to have some hand sanitizers, use that. But if not, use soap and water. When you're in the store, do try and stay, if you can, 6 feet or 2 meters from someone else. And if all of us use those measures, then we will reduce the spread.
And is there any concern about receiving packages, deliveries?
Well, again, we're hoping that the delivery people are also monitoring their employees so that they're healthy when they're delivering the stuff to you. It is known that the virus can remain on the surface alive for some hours or maybe even some days, but it's a very easy virus to kill. It just a very weak solution of water and bleach, such as a teaspoon of bleach to a liter of water. will clean the surfaces and kill the virus. So what you can do is after you've opened the box, if you can't clean it, if it's like a cardboard box or something, then just be sure that right after you've opened it and taken out what you need and you then dispose of the box, be sure to wash your hands carefully with soap and water. Then even if you've got some virus on your hand, you're washing it off, and do that before you touch your eyes, nose, or face.
Great tips, thank you. And is there any other messages you'd like to give?
Yeah, at this time, a lot of people are staying indoors and following the instructions to self-isolate. And a lot of seniors are staying indoors, or people with weaker immune systems. Some of these people live all alone. I'd just like everybody to remember that we're one big community and one big family doing this together. So think of those people in your neighborhood who might be lonely or who might need somebody to go out and get some groceries for them. Maybe drop them a note in the mailbox to let them know you're thinking of them. Perhaps call and volunteer to pick up some objects that they might need and leave them at their doorstep, or just wave at them through the window as you go by so that they know that you care. So please, everybody, let's take a role in taking care of one another. And the other thing we've heard is that some people are fearful of going to the hospital when they really need to. So if you have chest pain and you think you have a heart attack, please don't stay away. Or if you have another issue that you really feel needs an emergency department assessment, please know that the emergency department people are there for you, that they've got full procedures in place to prevent the spread of this virus within that organization, and it's probably the safest place to be in town right now. So don't hesitate to go to the emerge if you need to. If you don't need to go to the emerge, stay away. Please don't call the hospital for information about COVID-19. There's telehealth, there's a health unit. The hospital needs to be able to do its job.
That's great. Thank you, Joyce. Thanks for your time today.
Thanks. Great talking with you, Shane.